So the sixth question is, do I need to sterilize bottles and pacifiers after every use? So the answer to this question is, in a perfect world, yes. But for many parents, it is not realistic. We recommend washing bottles with soap and water after every feeding and sterilizing them overnight. See, it is important to sterilize after every use, but even if you are not able to, due to your busy schedule or any reason, so at least you should wash with soap and water. And but sterilization is very important, at least overnight. But I personally sterilize after every use, and pacifiers also goes the same. I sterilize after every use. And for example, the baby is having pacifier in his or her mouth, and it falls down, so obviously you will not give it to the baby directly. But if you want to give it, then before giving it, wash it with warm water and soap. And secondly, hand washing is equally important before making any food for baby, or before washing bottles. Your hand should be properly sanitized or washed. Alright, so the seventh question is green poop normal? So the answer is yes. Green, yellow, light yellow, CD mustard, all are normal. It depends on the baby, whether the baby is taking breast milk or formula, so the color changes according to that. But yeah, if the color is black or red or very thick, then yes, you have to consult a doctor. Rest, light yellow, CD mustard or green, all are normal. Alright, so the eighth question is that, how do I know when to start feeding my baby solid foods and which solid foods to start with? So the answer to this question is that generally before 6 months there is no need to introduce solid foods, because the baby gets all the nutrients from breast milk or formula milk. But yeah, some doctors recommend that if your baby shows signs that they're ready to eat solids, then you can start before 6 months also, like from 5th month. And the signs are maybe that when you are eating, the baby is moving the mouth like this, or maybe when you are eating, the baby is trying to snatch food from you. So if you see these signs, you can try from 5th month onwards also. And which baby foods to start with is which is very close to the breast milk or formula milk. That is, you can give mashy things like mashed banana, or maybe cerelac, uh, and maybe you can start with apple puree. And I'll make another video in which I will tell you baby foods, what all to start with. So there is no hurry to start baby solids, but yeah, if you see signs, then you can start before 6 months, but it is recommended to start after 6 months. Yeah. So the ninth question goes like this: how many layers of clothes does my infant need to go outside? So the answer to this question is that your baby needs one more layer of clothes than you are wearing. For example, if you are wearing a shirt and a coat, then your baby needs another extra blanket over there. For example, if you are wearing one layer, your baby needs two layers. It depends on the weather. Especially, this rule is followed in winters, that if you are wearing two layers, the baby needs three layers. So accordingly, you can try. Which is last but not the least is, when is it an emergency? So yeah guys, the first month of your newborn is very critical. So you should always feel comfortable in calling your pediatrician any time of the day or any time of the night. Maybe it's 2 a.m., 4 a.m. or any time. And if the newborn is having fever above 100 degrees Celsius, then you should definitely go to emergency. In every hospital there is an emergency room, so you can go there anytime. And you should always be in touch with your pediatrician. If you have any question in your mind, you should feel free to ask to your pediatrician, because she can guide you the best. So I hope that my answers will help you in some way or the other, and it will help you. So I hope you liked my today's video. If you do, then please hit a like and please subscribe to my channel, and please comment if you have any questions or any suggestions. Okay, see you in the next vlog. Bye bye. Take care.